Hello, Annika from Infection Prevention and Barbara Bohr from Infection Prevention. We're going to share with you today the technique for donning and doffing for our two common isolation categories for COVID-19. We're going to be talking about droplet contact isolation and the PPE necessary for that and removal of that, and then we're going to talk about full barrier level 1, which includes droplet contact and airborne protection. And we'll be demonstrating the PAPR for that type of isolation.
Great. So first, we will demonstrate donning and doffing for a droplet contact situation. So first, remove personal items. Limit jewelry and watches and additional clothing items such as white lab coat, jacket, and make sure your cell phones, pagers, and Voceras are in your pockets. Long hair should also be tied back. Perform hand hygiene.
Our favorite thing.
Once complete, put on your respiratory protection. This will include a procedural mask, and a face shield. The face shield will protect your eyes and face, while the procedural mask will remain clean for reuse. Next, don fluid-resistant gown, then gloves.
This gown is inside out, which often can happen when you get your supply. And the neck is most likely knotted as well. So it's generous usually in that opening, but if there's difficulty, then you need to have your colleague adjust it for you or get a different gown.
It is helpful in these situations to have a buddy, if at all possible.
So my gown is closed in the back. It's not draped open in the front.
Next step is to don your gloves. And you want to ensure that the gloves are extended down over the cuff of your gown. The last step is to verify. Check for damage of PPE and make sure your PPE fits appropriately and that you have full range of motion while areas of your body remained covered by the PPE. And now you are okay to enter into the patient room. All right. So next step will be doffing after completing patient cares. While still inside the patient room, you will want to remove the soiled gloves and gown. And by removing the gloves, you want to make sure that you're only grasping the inside and use the one finger approach to slip in and turn the gloves inside out upon themselves and discard in the garbage.
This would be garbage. We're recycling our demo PPE. Okay.
And then when removing your glove or your gown, which is also going to be inside the patient room, you'll, if you feel that you are contaminated at all during taking the gloves off, feel free to perform hand hygiene. Next, you will reach around the back to untie the back ties. And if you have a buddy who is still in there to help with clean PPE or clean hands, that is helpful as well. Next, you'll want to take the neck part, reaching from back and behind, and on the inside is to not touch your scrubs or the outside contaminated area, and reach out above your head and turning it inside out, touching only the inside non-contaminated areas and rolling it away from you. Once done, this can go in the hamper as usual. You are now free to exit the room and perform hand hygiene. You will now don clean gloves. And removing your face shield, making sure to take care of only touching the back strap and not any part of the front contaminated area. Next, with gloves on, you will use the purple top sandy cloths to wipe the front of your visor tube. For continuous patient care, place on the 3M hook outside of the patient room, or for intermittent care, store in a paper bag with your name and date. Next, you will remove the gloves and perform hand hygiene. And now you are completed for universal mask.
So this was covered with a shield. This is your universal mask. You can now go on and wear that in your work day. If this was questionable to become contaminated, you would change it and get a new procedure mask.
Mhm. So next we will be discussing donning and doffing full barrier level 1 using a PAPR.
So in order to do this, the PAPR will be inside your gown for full barrier protection. And Annika's going to demonstrate the use of the PAPR by first obtaining the battery from the charger that's plugged in. She's going to attach the battery to the blower unit. And then the next step is to verify if you're going to use this equipment that it has airflow. She's putting in the air indicator at the top of the blower unit. And now she's going to turn the blower unit on. And that's like a computer on button symbol. And you hear the beep.
And press and hold.
When the blower is up to speed, the unit will vibrate, so we're waiting for that sound. And now she's going to hold the blower unit so the air indicator is vertical, and she's going to ensure that the ball in the indicator is above the H level or 3/4 or greater in that tube. Once that's ascertained, she's going to remove the airflow indicator. And you always want to test that before you're all hooked up and ready to go into the room. Plus, clearly you'll be short of air in a very small amount of time. Attach the breathing tube to the blower unit. Line up the notch and press in and rotate to the right. Now it's secured. She's going to attach the breathing tube to the appropriate size hood. The hood generally, when it was new, came with a blue cover, which was for large, or white, which was regular. Now, with our supply does not meet demand, you most likely are not going to see that. So there is an indicator of size inside. There's a label.
So the large hood will end in the letter L.
Otherwise, it's a regular size. And knowing that ahead of time, as we use a common supply source, is helpful to figure out which you will use. Err on the side of large if you don't know. She's now going to do an appropriate fit with the hood. She's attaching the breathing tube to that hood. She's going to then take and put on the sweatband and elastic to encircle her head and forehead.
And there's a tab at the bottom you can pull down too to get a good fit under your chin.
And that's important. That hugs your face, so now you have a seal. The hood sits just above the ears. That's a common mistake that we make when we use this device. And the hood should not shift when you're moving your head back and forth. She's now going to secure the PAPR to her waist with the belt. She places the blower unit with the breathing tube. She's going to turn around, pointing up toward your head, and then the hose actually follows your spine. Make sure it's fitting properly. It kind of sits on your hips, and that the airflow is going to the front of your hood. With that, you've successfully donned a PAPR.
Mm-hmm.
Now she's going to prepare her gown for over the PAPR to provide contact protection with full barrier isolation. All of her jewelry again is off. Her hair is up for comfort. And if she has a buddy around, certainly they can assist if necessary. Her gloves are going on over her cuff. And again, before going into the room, is making sure everything is seated right and fitting right. You're now ready to do full barrier isolation going into the patient's negative airflow room.
Mm-hmm.
So the next component would be the PAPR removal. First, she has to remove her soiled gloves. You can tell me.
Slipping in, making sure to only touch the inside.
She does hand hygiene just to be sure she's clean before she starts to go up to her neck and face area. She's untying the gown in the back. She's going inside the shoulder area, over her head, coming from inside out, and rolling the gown inside, and then depositing in the linen holder. Hand hygiene again. Your respiratory protection, full barrier, gets removed outside of the patient's room. Remove the hood first by placing clean gloves on your hands. Go ahead, talk it through.
So I like to grab the back where the hose meets the hood, lean forward so you're not touching any of the contaminated part of the hood to your scrubs. Lift up and away.
So she's cleaning with her clean gloves on the external part of the PAPR at this point. She's going to disconnect the hose from the hood, holding the hood. You can, if you're by yourself, actually drop the hose at this point. And then she's going to,
Also do the inside as well.
with your clean gloves, so she cleaned the inside of the PAPR. And now she's getting ready to remove the PAPR from her waist, holding onto it so it doesn't drop to the floor. She's shutting off with the on-off button. And she's completed the removal of the PAPR, securing it safely onto a surface or with your buddy. With their having gloves on, hold it so it can be cleaned externally as well with a disinfecting wipe. Tidbits, don't throw away the hose. They're recyclable even in the non-pandemic situation. And now she's also going to remove her battery. The battery is good for how long, Annika?
12 hours, but we do ask that it is recharged after each use. And then you would be wiping down, like Barbara said, the whole unit and battery before placing it back in storage.
And you heard it click. So it lines up, there's pins, and then the click, and then the external wipe of this, and be sure that this is plugged in.
And that's donning and doffing full barrier level 1 with a PAPR.